here's the real star, Dr. Christa-Marie Singleton. She is the Chief Medical Officer, Office of the Policy Analytics and Population Health. And it says proposed there, but she actually did get that position. So we need to take that proposed off and, and post that. So Christa and I know each other because we are both board members at the National Alliance of Healthcare Purchasers Coalition. She's just been a champion of moving health policy forward. All of the bios for all of our speakers are attached to the agenda. And with no further ado, Christa, I'll turn it over to you.
Excellent. Thank you. And thank you for the welcome. I really wish I could be there with you all. If you had a chance to see my quick bio, I'm not sure if it's in there, but I have a connection to Indiana in that I'm a proud Notre Dame graduate. And so any chance I can get back to Indiana, I love it. And so this is a great way to be connected back with people that helped form my formative nature. So we can go ahead to the next slide here. I'm going to breeze through these first ones because I think you guys know this already. But again, just to show the big picture, again, we at the federal government level track vaccines across the country. And so as a country right now, we're over 400 million doses administered. Primarily, people are getting the Pfizer. There are 3 vaccines available, and they're primarily getting the Pfizer one. And you can see Indiana on this list here, and Gloria already showed those as well. So we'll go to the next slide. And again, the points that Gloria made, and we want to still continue to enhance, is that the vaccinations do work. And the goal of these vaccinations is to keep people from being seriously ill, hospitalized, or worse yet, die. And so what we are seeing now in this phase of the pandemic is that as people are unfortunately becoming ill and dying, that there's a huge gap between the unvaccinated people and the people that are fully vaccinated. And this is showing just data from within the last month or so of where it's showing. It's just when those hospitals, as Gloria showed, the unvaccinated people are taking up more space. They're the ones that are requiring more hospital resources compared to the vaccinated persons. Next, please. And then pulling in Indiana, what we were able to notice in our tracker is, again, the hospital case rates. And right now we're in a downward slope. But if you notice, the green line are the non-metro areas. So outside of Indianapolis, probably the bigger central areas, that's where the vaccination rates, the hospitalization rates are still climbing. Next, please. So again, I have a 15-year-old. And so when you're working with a teenager, sometimes teenagers are like toddlers in that you have to keep repeating things over and over again. So the message here is that all of these vaccines that are currently available are safe and effective. One of the things that we've learned over time and watching the behavior of people with the pandemic is that sometimes short messages have to be repeated. So again, millions of people have received this vaccine, and these are all vaccinated. These vaccines have gone through several rounds of clinical trials, and we, the federal government, will only authorize them if the benefits outweigh the risk. Nothing is perfect, and it is a risk calculation, but if the risk is being sick versus death, then we want to make sure that we give the best opportunities out there to keep people from being seriously ill and dying. And we at the CDC and our colleagues at the FDA, we monitor the safety of these vaccines. We debate back and forth the risk-benefit ratio, and we only make a recommendation when we see that that benefit ratio is much stronger than the risk. And the piece around here, is not only does vaccination protect you, the individual, but can protect those at increased risk for severe illness. Next, please. And again, these benefits protects you against from actually hopefully getting infected. Even if you are infected, the vaccines have been proven to protect people from getting seriously ill, protects the people around you, and protects you and creates an antibody or immune system response. So I'm going to go into that a little bit more too. Next, please. And again, I mentioned that there are 3 doses. We have the Pfizer, the Moderna, and the Johnson & Johnson. Again, tens of thousands of people, older adults, communities of color, people with different medical conditions, and none of these groups had serious side effects, and none of these groups had issues with hospitalization and death. But one of the things that is now up for a lot of discussion right now is the protection from the vaccines. How long does it last? Because the vaccine comes in and gives you, as I call it, a protective coat. But sometimes that coat over time starts to get a little softer, a little bit more thin. It still protects you, but not as vigorously as it does when you first got it from the store. And so that's now where the conversation is going. And let's go to the next slide and we'll talk about those conversations about next slide. So as I mentioned with that kind of coat analogy, you get that protection, but sometimes there's riskier ways to get that protection. We're not really sure how long the protection lasts. We've been in this pandemic now a year and a half. And we are seeing that first level of protection of those protective coat seems to peak around 6 months, and now it's starting to wane again, which is why now the conversation about an extra dose to help boost that protection is coming up. There is a lot of chatter out that people who get protected, when they get that initial protective coat from getting COVID, have this natural immunity. And so those who subscribe to the more natural homeopathic mechanisms for protection in their health, which is fine, outstanding. But what we're finding is that protection, even from your natural immunity, is still dropping. And therefore, when it drops, with that, your coat gets thinner and thinner, and you try to go out in the cold or the rain, then now your chance of getting wet, sick, goes up. And as Gloria mentioned already, she's going to stole my thunder a little bit. I think our society likes to go where the negative goes. And so you get one or two people on, as I call it, Dr. TikTok or Dr. Facebook, and say that they're, they had some friend who had something, or that they have infection induced immunity is the better way to go. A media story will pick that up and it will amplify. And what we were able to prove just recently is that getting vaccinated gives you that protective coat, and it builds that immunity, and you don't have to worry about getting severely ill. And this is actually personal to me. We have a family member who had COVID and was luckily able to be in a medical center where he was able to get additional antibodies on board. He was given the various treatments. He survived. He did well. But that was a long 2.5 week process where everybody was on pins and needles, rather than get vaccinated and having that protection. So my husband, my son, myself, we've gone that route, and we're getting our boosters as well so that we can keep that protection up. Next, please. And so just last week, this was a study done over the last 6-7 months of this year since we've had the vaccinations available. And so our researchers were able to study hospitalized patients that had symptoms similar to COVID, and then looking at those hospitalizations that Gloria mentioned, and show that unvaccinated people who had COVID were likely still to have a positive test compared to vaccinated people. So what this means is that, like my relative who had COVID last fall and may have symptoms, he's likely, even though he had that protection, he's likely to be in that category of getting another positive test again, compared to unvaccinated persons. And since Delta has come around, the Delta variant, which is the version we're seeing of the virus right now, again, if you are fully vaccinated, which means you either had 2 doses of Moderna or 2 doses of Pfizer or 1 dose of the Johnson & Johnson, you've been vaccinated, you are 5 times actually less likely to get infected at all. You're 10 times less to be in the hospital, and you're 10 times less to be hospitalized. So the goal is, yes, you can acknowledge when you have individuals say, well, I had COVID and I'm protected and I've got antibodies. Yes, you do. You did. You still may have them. And you can acknowledge that. And it's a both and that protection is dropping. As we time ticks on, it drops. And by getting vaccinated, on top of being having your infection, that gives you an extra level of protection to help you live your best life. And so that's why vaccination, even after COVID, we're seeing people that if you are fully vaccinated, it really does keep you out of the hospital. It really does keep you out of that time period of being sick and out and sick and worse yet, dying. Next, please. And so now we're also seeing a lot of chatter about people asking for antibody tests, because again, the common thought is that, well, I had COVID, or I might have been exposed to someone with COVID, and so I've got these protections and I'm going to get an antibody test. And CDC's continued stand, and the link is there in the slide, that we don't rely on antibody testing to determine the strength of a person's protection against COVID-19, because the antibody tests that are out there, if they detect antibodies at all, won't necessarily detect the presence of neutralizing antibodies. So again, I'm going to lean on my Notre Dame education. So I graduated from Notre Dame as a microbiology major. And so this is the kind of thing that I get excited about. And so antibodies come in, as I like to say, basically 3 categories. And it's like when you first get infected with something, the antibody response comes up. And so you get one level of antibodies that show up on the scene first. And then over time, a second set will come in, and there are the antibodies that can last for longer periods of time. The key thing you're wanting are what we call like the neutralizing or the killer antibodies. Those are the ones that show protection. And the challenge with antibody testing is the neutralizing ones are the ones that you really want. And they might not be detected if someone has had COVID and has mild or asymptomatic disease. And some antibody tests don't pick up the antibodies that we're getting from the vaccines. So the antibody testing concept is flawed in a lot of ways for COVID right now. And so if your employees are saying, I might not want to get vaccinated because I've got natural immunity, or I had COVID antibody tests, those CDC standards, those antibody tests are shaky. And so that's why we don't rely on those as evidence that someone is protected against COVID. And I've left the link there to show when the challenges with antibody testing, but CDC's current stand is not to rely on antibody testing to see if someone is protected against COVID-19. The proof of this last report that I showed is that unvaccinated persons, even if they have had COVID, are still likely to get infected again, and they are likely to end up in the hospital. So we're strongly encouraging people to get their primary series of vaccinations. Next, please. Okay, the boosters. So one of the things we've learned, so COVID is not like measles, mumps, rubella, or some of these other childhood illnesses where you get the one and done vaccine or the 2 and done, and then you're done. Sometimes you need a booster for things. So you have to, if you have tetanus vaccines go through every 10 years, you get a booster because that protective coat wanes. My 15-year-old just this week I got a call from his school, and he'd gotten a cut on his leg that required stitches. And the first question out of the gate was, does he need a booster? And so, yes, he's totally fully vaccinated, including fully vaccinated with COVID, but we had to check his immunization status to make sure that 10-year window was still intact, actually the 5-year window, because of the type of cut that he had. So over time, nothing stays forever. So we need a booster. And so what we have learned is that we're recommending a single boost for those high-risk groups. If you are over 18 and you had the Johnson & Johnson and it's been 2 months, get a booster. If you have, if you're immunocompromised, meaning like you've got cancer or you've got an organ transplant, we'll recommend that you get a single booster as well. Next slide, please. Got more on this one. Again, if you're those individuals that are over 65, so again, my 86-year-old mom just got her Moderna booster last week. If you're over 18 and live in either at a correctional setting or long-term care setting, and people 50 to 64 with certain underlying medical conditions, largely things such as uncontrolled diabetes, uncontrolled asthma, those are the ones that really, really, really should get a single booster dose. Where we say definitely run, don't walk to get your booster. If you have had your 2-dose series, we say you may get one if you want, if you're between 18 and 49, if you have certain medical conditions. But the reality is, we keep looking at this, is that, one of those underlying medical conditions is obesity. We saw that people who were classified as obese is tended to have worse outcomes from COVID. So those individuals are definitely eligible to get another booster as well. And again, if you have people that work in a hospital setting, or you're around frontline workers, if you're in that space, you could also get a single booster as well. We go to the next one, please. And again, getting a third dose or getting a booster, it does not take away from your fully vaccinated space. So if your employers are saying, well, do I have to get this next round to call myself fully vaccinated? And that answer is no. The fully vaccinated checkbox is that you've either had 2 doses of mRNA, or you've had the single Johnson & Johnson. And 2 weeks after that whole series is done, you're considered fully vaccinated. So as Gloria mentioned, I'm with the federal government. We're going through this process right now from the Biden administration, and everyone has to validate their status. And they're looking to see, do you have a 2-dose series or the Johnson & Johnson, and we all have to document our status as well. If you are actually recommended to get a single dose, if you have, let's say, you're immunocompromised. So let's say you've got maybe you're have a spinal cord injury, or you've got an organ transplant, or you have cancer. The reason why those people get an extra dose is because their immunity wane quicker than healthy people like myself. And so that's why some people get a vaccine, get a boost even more so, because some people never generated a protective response, some generated, and it's dropping over time. So that's why we're saying go get the third dose to help boost that and protect that immunity. After you get your booster, again, you can follow the guidance for fully vaccinated persons. If you're going to be in a high risk situation, you may want to consider wearing your mask. Again, closed settings where there's going to be a lot of people in close contact, you may consider, and you may know that there's some unvaccinated people, you may consider wearing a mask and some distancing. But again, the fully vaccinated piece and your booster, you should be in good shape. Next slide. Next. Okay, peds, let's go to the pediatric piece of it. So since I'm a pediatrician, this is great. All right, so now again, what we have been blessed to see with COVID with children is that although kids have not had COVID at the same rate as adults, but the impact is very significant. And we have seen a disproportionate number of children of racial and ethnic minority communities being impacted. Either they have had less access to the vaccine, or their families have chosen not to get vaccinated themselves. And so we're seeing more cases in these age groups. And we see a lot of the access to vaccines and the use of vaccinations in the before now 12 to 17 group, is that those individuals who weren't vaccinated were the ones who were showing up in the pediatric hospitals. And again, hospitalization rates are 10 times higher among unvaccinated teenagers than, again, fully vaccinated adolescents. And now that schools have opened up and most kids are back in in-person school participating in extracurricular activities, it's even more important to make sure that our young children have the most protection that they can, so that they can live their best lives. Next, please. So again, as I mentioned, they are less likely to develop severe illness and end up on ventilators compared to adults, but they are still at risk. And the challenge with kids is that it's hard to tell if a child is going to have a severe case or a mild case. There have been several kids who have developed something called multi-system inflammatory syndrome. So it's a case of immune complexes, and it's a serious illness in them. And we have seen that happen in kids predominantly in more racially and ethnic minorities. But again, it's a challenge. And so if these kids had been vaccinated and been eligible to be vaccinated, we may not have seen as many of these cases. And again, we're seeing that certain underlying conditions and our littlest ones might be at risk for a severe illness. And our little ones under 5 now, the way you protect them is you make a bubble of protection around them. So the adults, the parents, the grandparents, their neighbors, friends, family get vaccinated. Next, please. So again, ensuring equity. So again, kids that are homeless, kids that live in rural areas, kids that may have special healthcare needs, kids in our racial and ethnic minority groups, kids with disabilities, kids who live in group settings or unfamily situations, kids who have caregivers that might be non-English speakers. These are the kids that we are seeing where COVID has had a disproportionately bad impact in their communities. And so now that we have access to vaccines, we will have vaccines coming for them. They're the groups that really need attention to make sure that they can get protected against COVID-19. Next, please. So as an employer, what could be your role in ensuring pediatric vaccine access? So as you are trying to continue to promote these messages for employers, for your employees, for adults, educate parents and caregivers so they feel confident in their decision to get the vaccine for kids. We as parents will say, sure, I'll take something, but when it comes to my child, wait, I need more information. I'm not so sure about this. And again, it comes to that risk-benefit ratio. The way I grappled with it for my own family and talked to other families, and I've done a lot of talks to school groups here in Atlanta, is that I have a son who's an asthmatic, and watching your child struggle to breathe is the most heartbreaking thing as a parent. And as a physician, I can't do anything about it. And so I don't want that for him. So knowing that risk of COVID for him could definitely take his life or make his life horribly unbearable. And I see that kids that might be asthmatics, that have been in this situation, have gotten this vaccine and have done well with it and have avoided COVID, then that became my answer. And so you as an employer can get testimonials from parents, testimonials from your pediatricians and your family docs who are going to be in this front line. And then they can tell that quick story, work with these community groups to engage families to get demand. And then talk with the teachers and faith-based leaders here in Atlanta. The teachers that got vaccinated were, please, when can the kids get vaccinated? So they can say how we can get our kids back together. You as an employer that work with these community groups, again, teachers, the faith-based leaders, the community leaders that support your employees to get them to work, you as an employer as their partner and say that we're all in on this together, can help get your employees get vaccinated themselves, B, get their kids vaccinated. Next, please. So again, more things that employers could consider doing. Again, show how vaccine requirements have helped reduce the spread of COVID in the workplace in their community. So Gloria's got great slides. I love your dashboard concept. Again, the more people that are vaccinated, the rates keep dropping. And we saw earlier that, workers are resisting the requirements. And so when you start to drill into that, are you, asking for more information, or are you just absolutely against it? And so one of the things that we've seen here is to align it with values that resonate with them. Some of the strongest messaging we're seeing right now is, I need to make my own personal choice. I need to have the freedom to do this. And a mandate is taking away my freedom, my liberty. And so one counter conversation to consider is that vaccination helps you take personal control of your life. We absolutely respect your personal right to choose. Having this vaccine allows you to take that personal choice and allows you to be free to live a healthy life. And again, Gloria and I are working with the National Alliance. We are working with multiple employers across the country, and we're doing a pilot project actually not too far south of you, in Kentuckiana and also in Pittsburgh. And we are finding that the role of the local organizations trusted by the employees as the messenger, and having those employees and those community groups come in and talk about this is a lot stronger sell sometimes than maybe the CEO of that employer. So partner with those local groups can be your messenger as well. Next. more things here. So again, this is also from the Kaiser Foundation. So in this study, they polled employees and asked them, what could be roles for the employer? So if the employer offered paid time off to get COVID vaccines for children, particularly around lower income families, lower income workers, at this point, it's kind of in the middle. Are you going to let them have time off? The higher income employees, their employers are allowing them to take time off, recover from side effects, take the kids to the vaccines, to get the vaccines, care for kids if they have vaccine side effects. You might want to consider, now that we're having the pediatric vaccines on board, more flexible leave policies, because the kids are going to have sore arms. I had a sore arm, adults have sore arms, and they may be tired for a day or two. And sometimes, again, I had to chuckle a little bit with my teen boy. The first round, he was tired, and then the second round, then he was nauseous. And so it's kind of watching to see how much is nausea, how much is him, how much is whatever. But he needed to have a couple days at home, and I needed to have the time off to do that. And he was actually working at a local grocery store, and his employer gave him day off so that he could recover from that. So that when you have that kind of surrounding piece for employees, say, I'm going to get my kid vaccinated and I need a couple days off, that would be really helpful, because an employee may say, I'm in, but I can't take time off from work to either get the vaccine for my child, and then also now for this kid to have a couple of days of rest. So the more you can support that, that will be helpful. And then let me go to this next slide here about meeting people where they are in terms of employee policies. Again, 1 in 4 parents of these unvaccinated teenagers said that if the employer offered paid time off to do so, that would help their vaccination status. Okay, let's go to meeting people where they are, because I know my time is running short. So again, this is a process, and you all have been in this with us, and we thank you for your support and partnership. When we first got into this process, we had several employers come to us and ask, well, can't you just give us a spreadsheet, a quick sheet or a handout to do this? And what we learned over time is that building trust and vaccine confidence is critical, and you as an employer can address these information gaps by just consistently saying the same thing. Vaccine helps protect us. Vaccine gets us back to our families. Vaccination helps us be together and keep people out of the hospital. Next, please. And it's going to take lots of conversations. And again, when that hesitancy is coming more about lack of trust, when you bring in a trusted messenger, that helps out. And allow people to ask those questions. Next, please. And so one of the things about community voice is what we have heard, and I'm giving one here from our colleagues down in Tennessee, is this is one where they have, if you click on this link when these slides are available, is how they had messengers from within various pockets of the community. And they created these very short, meaning like 1 minute videos that you could use to hear the community voices of how they did this in Tennessee. I'll go to the next one. And again, roles for faith-based organizations. And so when I was living in Indiana, I was very sensitive to that and supportive of the role of the church and the community, and where this could help. Your faith leaders can be your partner as an employer to ask these religious leaders to encourage COVID vaccination. So Gloria mentioned about the larger denominations, the Catholic Church, the Episcopal Church. These larger churches have come on board. Maybe it's not so much some of these others, but again, as the faith leaders lead, then the community tends to follow. This link here that's on here about facts in the field, where different church groups have had, again, different types of community ministries. So a lot of churches have health ministries. So those health ministers became the spokesperson, not so much the pastor. And if the religious leaders, though, again, those nurses in the community, those workers who aren't necessarily in a particular space, and they talk about their experience in getting people back into the church, back into the community in person, that has been shown. And these are different stories that I would encourage you all to investigate and see how that could be a match or model for you in Indiana. And then lastly, I'm going to go to an example that you may want to emulate, I suggested as I'm a big fan. Next one is an example coming out of Virginia. And I wasn't able to embed a video because I knew my time was short, but a colleague at he's the head of the Virginia Cancer, VCU Commonwealth Massey Cancer Center. And he has created a group of faith leaders, diverse faith leaders from all walks of the faith community. And it's called Faith and Facts Fridays. And so every Friday, these faith leaders get together and talk about issues in the community. This particular example one is on health equity, but they came together to talk about what could the role of the church be. And so if that's a key piece of your community, those church leaders could be your messenger. And so they have this open space to talk about and meet people where they are and ask these questions to get, again, the goal is to get the faith community back together so that people can worship and pray and be healthy in their community and be part of that network. Next there, please. We're coming to the end. And again, meet people where they play. So I know Indiana has this thing called the Indianapolis 500. I don't know if the Indiana Health Department tried this approach, but down here in the South, this went over pretty well. They did a vaccine clinic at Talladega. And what you got to do is after you came and got your vaccine, you got to follow a pace car around the track. And so for that group, that was a big way to get people. So sometimes, we found that the financial incentive helps to a point. We found that the lotteries it was nice splash, but didn't work. Meeting people with certain things like this, where it fits with their values, it works. So for this community, running around the track, driving around the track, that met them there. So what works in Indiana, if that becomes the incentive, maybe that might be something to add to your arsenal. And then lastly, I'll leave you with this, considerations and resources for employers. This is recently created a field guide, strategies for within the community. In this list here, if you go to Appendix A, it has a list of the different hospitals and health systems that are requiring vaccines for workers. And if your hospital or health system is considering a vaccine requirement policy, there's actually the vaccine requirement example from Houston Methodist. They were the first ones to go down this pathway. Again, as Gloria mentioned, a lot of people, we get a lot of noise and chatter about, well, the workers are going to walk off, and some do, but when you look at the big scheme of things, it's a small number. And so this field guide has examples and some of the legal parameters, examples of where people who have gone that route have done with their work. So I will stop there and thank you.